Hello, everyone. Today's our sixth AI in Healthcare talk. So our idea started with COVID-19 time. We just maybe talk about how we can utilize that time and get more out from the labs, from people. And this gave us a great opportunity to connect people from healthcare and data science. And I introduce myself first. My name is Murat Baday. I'm a co-founder and CEO of Magnimind Academy. I'm also co-founder of SmartLens. SmartLens is a contact lens company. We make contact lens for eye pressure measurement. We are targeting glaucoma patients. And here in Magnimind, we've been organizing several educational events and activities. And we have over 10,000 members from data science community throughout the US and different meetups. And we have organized over 100 events last year, free events, lectures, webinars. We have free mini boot camps that really helps people to just get in track with data science. With this program, we want to combine or bring the two expertise together, and healthcare specialists and data science specialists, and hope that idea that whatever we talk here, insights, will help people maybe engage in new activities and innovations. And I should mention that this event has been broadcasted in 6 different platforms, including YouTube and Facebook and others. So if you have questions, we can get from YouTube questions, somebody's tracking those. There's a lot of conversation and questions been asked in this Zoom meeting. And please ask your questions from Q&A, where it will be more easier for us to track. We are welcome to hear the chat if you have other things and other comments, but we get the questions from Q&A, and we are trying to reflect those questions to speaker. And I will actually let Ryan and Chirag introduce themselves, and Chirag will make the introduction our speaker today. Go ahead, Ryan.
Hi, so I'm Ryan Spitler. I direct the Precision Health and Integrated Diagnostics Center at Stanford, as well as the Canary Center for Early Cancer Detection.
Hi, everyone. My name is Chirag Patel. I'm a clinical assistant professor of neurology and radiology at Stanford. My research focuses on glioblastoma, and my clinical focus is also in patients with neurologic conditions. Today, it's really a pleasure to be able to introduce our guest speaker, Dr. Joyonna Gamble-George. She's an award-winning neuroscientist, artist, innovator, and entrepreneur. And trust me that I couldn't tell you everything that's on her bio sketch from her website, because it'll take up the whole hour. So I tried to abbreviate it. So my apologies with that, Joyonna. So she graduated cum laude from Xavier University of Louisiana with a BS degree in biochemistry and biology pre-medicine. She later earned a Master of Health Administration from the University of South Florida College of Public Health. And she has served in the healthcare field from a clinical, administrative, and research perspective. Her long-term career goal is to examine how interactions between social, lifestyle, environmental, and/or hereditary factors contribute to brain disorders and other health issues in health disparity in medically underserved populations. She plans to use animal and human cell-based models and biotechnology to determine how drug, lifestyle change, and/or social and environmental enrichment strategies can alleviate negative consequences in the brain and the body. To achieve her long-term goal, Dr. Gamble-George has co-founded SciX LLC, which is a biotech Internet of Things application development company. And SciX is dedicated to creating science-based and health-related mobile, wearable applications and devices for monitoring and responding to risk factors responsible for various health conditions, human behaviors, and neurosensory thresholds in order to predict, prevent, and manage life-altering events. So with that, we would really like to welcome you, Joyonna. Thanks so much for being with us today. And,
thank you so much for having me.
Feel free to let us, yeah. So thank you again. So could you tell us a bit more about your startup, your company?
Yes. So as you stated, SciX is the Internet of Things. We develop software application and devices. And we really came up with the idea for the company. I'm a scientist by training, and the other co-founders, they're technologists. So we really wanted to bring our expertise from different fields together to really solve social issues in society. And one of the industries that we're focusing on is healthcare. And one of the projects that we're trying to create is find data science-based methods that can do three things: monitor in real time an individual's health condition, predict life-threatening events due to that health condition in advance, and then try to prevent that life-threatening event from actually happening, so you won't have any long-term consequences. So one of the health conditions that we're focusing on is heart disease. There are a lot of people throughout the US and even across the world that suffer from heart disease. And some of the life-threatening events are heart attack and stroke. And you know that heart disease, it can lead to reduced quality of life for people, as well as bring about long-term disability if you do suffer a heart attack or stroke. So what we're trying to do is create a wearable device that serves as an alert system to the emergency medical services to let people, let them know that somebody might be in a process about to have a heart attack or stroke. And we want to get data from like vital signs and other symptoms that can sort of predict if somebody's going to have a heart attack or stroke. And how we're doing this is actually creating this algorithm that can make sense of data from different resources. So you're going to get data in real time from the wearable device, and then you're going to also get data from pre-existing medical histories of patients. Because when it comes to really predicting heart attack or stroke, you just can't go by if some abnormal heart rate is going to lead to it, because that doesn't necessarily mean it's going to happen. So you really have to understand if there's any pre-existing medical histories or things that might be recorded when you go to the clinic for your blood work, or you go to a public health department, that really can translate into your risk for a stroke or a heart attack. And the way we make this very efficient is that we place that algorithm on a blockchain. And then with blockchain technology, it's basically a way of record recording, but you can lead to efficiency of their record recording. So if you're getting data from all these different sources, help us with the efficiency of data crunching and making sense of it to lead to predictive analytics. So that's our first technology that we're in the process of creating. Then we're also working on another project in conjunction with other biotech companies, where we want to create a wearable device that actually can record brain activity while somebody's using a virtual reality device and actually performing these exercises to help increase their range of motion. So this is somebody that might suffer from Parkinson's, or maybe it might be somebody who did suffer a stroke and then they have limited mobility. So while somebody's, doing these exercises with their virtual reality device, trying to improve their, range of movement, we'll also want to record their brain activity to understand their motivation levels. So what exercises are actually leading to not only an increase in this range of motion, but also making them much more happier, because maybe their movement is now increased. So those are two of the projects that we're currently working on for the biotech company.
Well, it's really exciting. I mean, it seems like this great intersection, because some of the current diagnostics we use, like let's say an EEG, is just not feasible to do it in a home setting. But if you can develop with your colleagues, your partners, the technologists at your company, the maybe minimally invasive or easy to use acquisition devices that have maybe less data, maybe more noisy data, you can then bring to bear upon that the AI technologies to maybe see the signal for the noise and try to bring out that information in a very broadly applicable way. So that's really exciting. And also, the idea you were talking about with strokes and heart attacks, I'm trained as a neurologist, and we always say that, time is brain when it comes to a stroke. Yes. And likewise, time is heart when it comes to a heart attack. So I think, just as what we were saying is that you can kind of scrape through the existing record of the patients to risk stratify them, and then get some kind of maybe a sign of acceleration towards an event, or maybe the event itself. That's really exciting and really impactful. what have been some of the challenges you found in terms of interfacing, because you're obviously trained as a neuroscientist and trying to bring all these wonderful ideas to reality through the
Yes.
technology collaborations?
Yes. So I think trying to, I guess I understand a little bit of, you know, how sometimes the heart can affect the brain affect the heart, but I might, since I'm not a trained physician, I might not know all the ins and outs. So we do have to consult cardiologists for help to get that, you know, added extra information that we need to really make sense of the data that we're looking at. So that's one of the things. And I think also just with dealing with anything that's data science based or artificial intelligence, you really have to really pay attention to all the biases, you know, where you're getting the data from, the algorithm that we're creating, it could be biased. Maybe the sample that we're getting all the data from, maybe it's not powered enough. Maybe it's not diverse enough that we can really pick up on, you know, make a prediction about whether somebody's having a heart attack or a stroke. Then you have to think about measurement bias. That might lead to maybe there's a faulty measurement that can lead to systemic distortion of all your data. And then also prejudicial bias, making sure your sample population is very diverse. It doesn't have any stereotypes coming from the people who are actually creating the technology. So those are some things we do have to think about. But also, I think with what we're trying to do, we also have to think about regulations, you know, making sure that the data is secure, because you're talking about accessing people's personal, you know, their medical histories. So we definitely got to get, you know, permission from the patient and also from the healthcare providers. You know, can we access these patients, you know, data so we can help them with their particular health condition? So that's dealing with access to the data, privacy, security, also the heterogeneity of the data. Just if it's too diverse, maybe it's really so complex that you cannot really make sense of it and make those predictions. And then also there's data harmonization when we're getting data from different sources so we can really make sense of it. So those are some of the issues that I think in general, I think anybody that are entering into the data science field will be exposed to, but also for us as well with this biotech company and the project that we're working on.
Oh,
Yeah, very interesting.
Sorry, go ahead, Brian. Yeah.
Oh, sorry. Yeah. So I was just going to say, you know, you mentioned all the different data streams. So is the idea that this is like a standalone device? You know, you mentioned the medical record and some of the other data sources, but what about other potential wearables? Is it meant to interface if you had like a pacemaker or something like that?
We haven't thought about interfacing with a pacemaker, but I do think we would have to, if somebody did have a pacemaker, we would have to take that into account because it's, you know, it's really regulating their heart beat. So, and that can, if something happens to the pacemaker and malfunction, that could lead to a heart attack for somebody. So I think those are things we definitely have to consider. We haven't thought about that yet. We were just thinking about basic like respiratory rate, heart rate, and some of the stuff you get from blood work. We haven't gotten that step, but we do need to consider that because it's something that is definitely a variable that we have to really account for when making these predictions.
And I guess the other thing that's kind of related to any kind of wearable is, you know, getting the people to actually use it. So, you know,
Yes.
people don't even take their medicine, it's in the best interest. So how do you combat that challenge?
I think for that, I think there might be some people that'll use it, but then there's some people maybe that are very much older, like the elderly, that might not be tech savvy and know how to use technology. So I think with there, you have to train caregivers that actually help these people to understand how to use the technology. And then also train the patients themselves, but make it so much that it's very easy for them to understand. So that's where data literacy is really important. And then also trying to get maybe any family members on board with understanding the technology. And then also maybe feeding the technology into like health insurance companies that definitely are going to be dealing with the patients a lot, not just the medical providers in the healthcare system.
Sure.
It's very interesting. You mentioned data literacy. There's a question coming in from the community here about health literacy and, you know, the patient's ability to understand their own health.
Yes.
And they're saying if the software suggests medications based on what the patient self-reports or thinks about their health, is there an accountability issue here? Can we accommodate a margin of error if the patients don't report their conditions well or accurately based on their own understanding of their health or what has been explained to them? Maybe there's a health literacy issue.
Yes, so that's a good question. So I think one way to combat that is it depends on what they're reporting. Is it something that we can measure physiologically? So that might be easier for us to take from with the wearable device versus somebody just talking about, I feel really bad today, just their mood. So I think what is important is making sure that the device also is connected to medical providers, like where the patients can talk to the medical providers. If they're not feeling so well, you don't necessarily, because sometimes you might have irregular heartbeat, but that doesn't mean you're gonna have a heart attack. So maybe you just want to talk to your physician and be like, I'm not feeling so well. And the physician might know a little bit more about your circumstance, where then they can intervene and help, where the device doesn't necessarily have to do something right then and there. I think the other thing in terms of health literacy, the other thing is like language barriers. You have to think about that. People speaking different languages, communicating with that, different educational levels. So it's a way you have to just make anything when it comes to health technology, you have to make it so that it can reach different diverse populations. And the way you do that also is doing user experience, getting samples of these populations that you want to target and get them to play around with your device and see what works and what doesn't work. And by doing that, you can actually modify it such that it can work for a broader or larger, sample size or population.
I really didn't think about that. It's kind of, sorry, go ahead.
Yeah, go ahead.
Yeah, I was going to say, like, the way you're describing it, it sounds like, like almost like a new food product in a way. Like, you have people taste testing, but really getting a hold of the device, touching it, feeling it, how does it integrate with them? I think that's a really important part about that user experience.
Yeah, I think one question I have, there are a lot of now telemedicine devices.
Yes.
So are you considering incorporating with them, and how is that incorporation will happen? Because every company has their own financial interest.
Yes. Yes, it seems like the healthcare industry is flooded with a lot of interventions for telemedicine and telehealth. So I think there are ways where you can definitely sync with other devices. Maybe you can sync with Fitbit, other wearables, or whatever healthcare systems are currently using. You just have to make sure you get them on board and really get them to see the benefit of using it. The thing is also, you don't want to overburden the medical provider because they have so much to deal with already with, the patients that they're seeing and their workload. So you don't want to burden them. So I think also when it comes to user experience, you also have to have the medical providers test out the device and is this really worthy for my patient? Is it also worthy of my time, as a provider? Is it going to really help me, increase my efficiency of my workload? So then I'm less burdened as a physician. So I think we have to take all of that into account.
I think getting to the point you were making about the emergency nature of a stroke or a heart attack, would you ever foresee a future where a lot of your readouts or predictive algorithms would interface with a triage nurse in an ER, for example, to give a heads up that, hey, we're concerned this is, about to happen. Could you, or with an EMS company or the ambulance service provider or whatever it may be, to kind of anticipate before even the family members find the patient down, after maybe 20, 30 minutes, whatever it is. Something like this where you can get rapid action just so we can try to salvage as much as possible.
I do think those are possibilities. So we have like a 3-tier system based off of how serious the health condition is or the life-threatening event. So if it's not as serious, we might just give tips to the individual, just tell them, oh, these are things you can change about your behavior, whether it's just eating habits or maybe they're just overexerting themselves. Then the second level is what you were talking about, the triage, where you talk to a medical provider or a nurse, or maybe a nurse practitioner, and they can talk to the patient and give them advice. And then the more serious is like, oh yeah, they're about to have a heart attack. So that's where you will alert EMS to immediately come out. Because time is very important, especially when you want to prevent these long-term disabilities that can happen down the line from when somebody has a heart attack or a stroke. So that is definitely a possibility.
So that another issue, as we discussed, you collect a lot of data from people.
Yes.
And other devices collect a lot of data. And one thing we discussed that is sharing with those insurance companies. So also you're a fellow in health policies.
Yes.
So, and that comes to how good to share those information with insurance companies so they won't increase our, insurance rates.
Yes. So I think with that, you really it has to be all about buy-in for these other companies to get them to really get on board with sharing their data and really seeing the benefit. So I think just creating like a collaborative effort where they're part of creating the technology or even improving it. So hopefully they will buy into it. I think with health insurance companies, they might be able to buy into it because they won't have to worry about all the charges that will come to them if somebody actually does have a heart attack or a stroke. So I think it'll be an easy buy-in for insurance companies. I think it'll be a harder buy-in for patients, that are coming from different diverse populations, and also the medical providers with their workload already. But getting other companies, I think they'll be okay with sharing their data if they really see that it's a true benefit to their company as well. So I think we have to take all of that into consideration. In terms of policy, because I am a AAAS Science and Tech Policy Fellow at NIH. So I think there can be, because data share is a very important issue, because not everybody wants to share their data. Sometimes they want to keep it to themselves. But I think when it comes to really improving humanity, we have to really be up to sharing data. But in sharing data, we also have to make sure that data is really secure and we share it for the right purposes. So there can be policies that you can set in place where you can start it at NIH and it can go before Congress and become a bill and maybe a law where you set that, under certain circumstances, maybe we can share data, or maybe we can have certain regulations on what can be shared versus what can't not be shared. So I think we have to really think about all of that and take that into consideration. That was a very good question.
I mean, related to that, I will add, there's social media companies. If you read all these terms, you have a right to use your own data, like Twitter, Instagram, but they have also right to use your data. I mean, and in this case, yeah, you have a device, you have an app, you have a right to use data, but patient has a right to use that data too. My point is, if patient may want to share your data with some other app's data, and things may get complicated in there. Is there such a platform? Maybe your platform utilize that as well.
So I think for that, that's where virtual machines and cloud technology comes very important, because it's accessible, but you can also make it very secure. So I think from there, you have to make it permission where the patient, because you don't want them sharing some of the data with certain companies, because those companies might try to take advantage of them. So just to be honest, so you have to definitely have like permission and regulations, like who can access what data, when they can access it, who controls the data as well. So you have to take all of that in consideration. But I think cloud platforms, you can get that through like Amazon Web Services, or Google Cloud Platform is another example, where you can store all the data there and manage it and then access it in different parts of the world. And also you can make it like permission and more secure and safe. But you really have to really think about like who is going to access it when, who's going to be able to control it. And it has to be for the right reasons and the right purposes.
Yeah, I kind of have a related question in terms of like the big data silos and aggregating all this data. From the NIH perspective, there's a lot of different ideas going around. And like when I looked at, instead of seeing like a request for proposal or request for, it's more request for ideas and other things from the NIH. And so I was wondering what kind of initiatives and things that you've seen that have been good ideas. I know it's a tough question, but I'm sure you see a lot of really interesting insights.
So one thing they're doing a lot at NIH, they're training a lot of their employees in data science-based techniques and tools. I'm an example of that, because now I actually have access to like free courses online that probably cost like hundreds of thousands of dollars through Amazon Web Services, where they're teaching me about cloud computing, data engineering, architecting, machine learning. So that's one thing. They're equipping their current staff with the data science tools. which makes it a little bit better when it comes to interacting with scientists, not only within NIH, but also outside of NIH, who, down the line, they want to apply for a research grant. You can actually give them expertise on their research proposal. The other thing is there is a program called the All of Us program, where there's an initiative at NIH where they're trying to collect data from 1 million people or more. And this data is supposed to be very diverse. It's supposed to be about phenotypic data, clinical data, demographic, geographic data, even genomic data, and we're bringing it all together. So just having that platform, and then scientists are going to one day be able to access the data, and then they can apply their own data science, technologies and tools to make sense of it, or to try to understand, how human disease, works, and how we can actually, alleviate it.
So I guess another question, Joyonna, is that it's so the pace of advancement in the field of AI is so fast, and so I think it's great that you have the access to the courses. Do you supplement that by working with a team of data scientists? And if so, what have been some of the challenges in interfacing kind of, there's so many languages going on, from the neuroscientist language to the clinician's language to the data scientist language? I think that's where we make those big advancements, but what are some of the challenges you've had to overcome to make those communication barriers as small as possible, so you can kind of all be on the same page as to what the common goal is?
Yeah, so I think a big thing is just trying to understand the technical lingo from the different disciplines. So for me, I think that's why I'm trying to become a technologist. I'm actually trained as a scientist. So that's why I'm taking all these courses, so I can understand when the technologists are talking to me, I get what they're saying. So I've been taking courses like Python and R and Math Lab. I actually started doing that when I was in grad school. But the other thing is that there's a lot of initiative going on where they're actually training, technologists to understand, the language of a neuroscientist or just a basic scientist. So just having like a two-way street where we try to understand each other's worlds, and then we come to a common ground where we just use sort of like common terminology or something that's very understandable for both sides. The other thing is creating like dictionaries, or being able to define terminologies for people so that they can understand, will help definitely in breaking down those walls and those barriers and trying to really communicate. But the key is to really try to educate yourself in other fields. Go and talking to people, listening seminars, webinars. I do that all the time because NIH, they have like a video cast. So they have this archives of all these videos where people talk about artificial intelligence and technology. So I make use of that. I try to understand that technical lingo. And then I know the technologists that I work for in my biotech company, they actually try to understand my neuroscience lingo. They even talk to me about, oh, well, tell me about this brain region. What does it do? So, we actually try to help each other to understand. So just really having that form of communication is very simplistic, not too complicated, but then amongst your own people in your field, you might be a little bit more complicated.
Yeah, I like to comment on that. What I see, a lot of scientists or clinicians, they have a lot of data, but they don't have that skill set to analyze, to look into data. And they don't even have a network to be able to do that. They have to approach people, but there's no such easy way of communication. Same for data scientists, great data analysis skills and machine learning skills, but they don't have an access to data, which is very precious. So I guess one way to do it, to approaching people like you or many others, just collaborating. That's what I recommend our data scientists. Yeah.
And I think, kind of to your point of all these kind of different integrated like disciplines are coming, you produce a lot of really interesting people. But one of the challenges we have, especially through the FIND centers, we're trying to kind of create a whole new field of precision health. And so a lot of like NIH and other budgets are understandably, they focus a lot on like treatment efficacy and those types of downstream mechanisms. But a lot of times it's a lot harder to look at the front end of the disease continuum in terms of getting funding. And also like just on the innovation side, you might have someone starting a whole new field using mental neurological approaches that, that people haven't seen maybe at the NIH. And so what advice do you have for those kind of investigators so they can still kind of get into the system and be seen in a good way by NIH review?
So one of the things that they can do is talk to a program officer for I guess whatever field that their technology focuses on, and get advice. They can send like their specific aims for the grant proposal, and usually the program officer will critique it and tell them if it's good or not and what they need to change. Also, if you have a technology company and you're creating these technologies, or it could be at a university creating them, they do have application assistance programs for entrepreneurs and people who are creating tools. And they will help you with your competitive strategy, because they'll ask you like, who are your competitors? And they will actually create a write-up for you. They can use for pitches, at competitions down the line. Also, they will ask, what do you need in terms of organizational capacity? Do you have all the resources? Do you have all the staff that you need? They'll go over that, and they'll go over your proposal as well and critique the entire thing. So that is actually at different institutes. I know there's application assistance program at the National Heart, Lung, and Blood Institute. It might be some as well as the other institutes. So that's another thing. And then I think, trying to think of the other advice. I think I lost my train of thought. What was the question again? I had one other thing I wanted to say. Because I said program officer. Go ahead.
Oh no, I was just going to say, we're just curious of, the best advice you have in terms of kind of progressive type researchers, for fields that don't exist yet necessarily.
Okay. Oh, then the other thing is definitely collaborating. Sometimes if you're on the outside, maybe you might want to collaborate with some of the scientists that are already at NIH who might be going in a similar direction as you. So creating really multidisciplinary collaborative teams. Then the other thing is there are grant programs that they can apply for. These are STTR or SBIR. So SBIR is Small Business Innovative Research Program. And the other one is the TT stands for Technology Transfer. So that's if you're like at a university, you're like a biotech company, but you want to collaborate with a university. So this with a lot of like intellectual property decisions you have to make on who controls, the rights to the technology. So definitely apply to those programs. You can apply for them at the National Institutes of Health, and then also the National Science Foundation has it. And they give out a lot of money. Sometimes it'll be up to like 1.5 million or 500,000 if it's like in the first phase of your technology. And then also at NIH, they have these grant opportunities that are called high risk, high reward. So those are for very risky projects where you write, your grant proposal is not very similar. It's similar to an R1, but you don't write it in the same way as an R1. You write it as a narrative, like you're telling the story about the technology that you're creating. So those are some, if there's something that's really risky, that's just out there, nobody have heard of, definitely try to apply for those grant opportunities that are high risk and high reward. And they're under the NIH Common Fund.
Oh, that's really helpful. I'm sure a lot of our listeners would probably could benefit from a lot of those opportunities, including myself, of course, as well. I guess one other kind of follow-up question, I think, for like trainees. You mentioned that, you started doing these different classes. It's been very helpful for you, even in grad school. So I guess as new trainees are coming up, what advice do you have for them in terms of balancing, being kind of have a core domain expertise versus taking on, because there's a chance of, okay, I'm going to take this, and you kind of dilute yourself out of it. Or become a jack of all trades, but not a specialist. And so how do you keep yourself as, relevant for what you need to do, like giving all these opportunities?
So what I did when I was in grad school, I took all my core courses first, and I really focused on my neuroscience research. Then when it got near the end of my PhD program, that's when I started taking a lot of electives and things I might be interested in or I wanted to learn more. But when I took these courses, I always had a end goal, in sight, what I wanted to do down the line. So I'm always like the person I plan in advance. I try to figure out what I'm gonna do 5 years from now, 10 years from now. So if I have an idea, I'll just write out what I want to achieve in order to make that idea a reality. So if it's creating a technology, maybe I have to take courses, and help to create that technology. Then if I'm a graduate student at that time, then I'll take those courses as electives at the end. The thing is, you don't want to take too many courses because it just it might be a little cumbersome, you know, with what else you have to do, like doing the research and any other core courses you have to take. So that's why I definitely try to do that near the end when you got most of it out of the way, you pass your qualifying exams. Then also you can take a lot of courses online for free or sometimes for a small cost through Coursera, because that's where I took a lot of the courses that were led by the Google and Amazon and learning how to do cloud computing. And also there's edX, they have a lot of data science courses as well.
An interesting question came in from the community here. They're saying that in neuroscience, there are still lots of unknowns. Although measurement of, although measurement of neural signals is possible now, how will the field evolve before one can reliably correlate or establish causality, such as a signal to a particular disease condition?
I think right now, there's a huge focus, especially in the basic science and even neuroscience. A lot of them are focusing on multi-omics. They want to understand at the cell level what's going on. So they want to know what the neuron is doing, the microglia, the astrocytes, the oligodendrocytes in the brain. And then they want to understand, oh, how they're interacting. And then what's going on within that cell. So they're doing transcriptomics, they're doing genomics, metabolomics, lipidomics. So I think right now there's a huge focus on bringing that all together to understand how these different cells communicate, interact, especially in terms of brain health and disease. So I think that is a big focus. And then I think what's going to happen is once they really start making more sense and using data science-based tools to make sense of that data, then they're going to start trying to integrate that with neural signals. And by doing that, then maybe just based off of what you get from these multi-omics data sets and what are the differences with the signals, you could probably predict, you know, if somebody's having a particular brain disorder or maybe the severity of it, or maybe they might be at risk for it.
There is something I like to add that maybe I like to learn your opinions as well. So let's say you're looking for cardiovascular problems in the maybe heart, okay?
Yes.
And like neurological problems in the brain. But what I am also hypothesizing that you may see some symptoms in another organ or another attitude. So I believe such kind of things will be possible with devices or integration of several devices and apps and platforms like yours.
Yes.
What do you think about? Do you have such estimations, predictions on that?
Whew. I think that's very far out in the future. Because I think sometimes we just don't even know everything even about the brain. So just trying to integrate that with all the different organ systems. But I'm hoping in the future that we can have very simplistic wearable devices that can measure brain activity and other signals throughout, you know, our bodies, where you can understand, you know, when something is going on in your brain, maybe also it's related to what's going on in your heart or maybe in your kidneys. And make sense of that, because I think when it comes to medicine, it has to be holistic. You can't just take one organ and say, oh, because of this is like totally disconnected from the heart. You know, sometimes it's integrated because our organ systems work together. And also you have to think about our circulation system. It feeds all of our organs, you know? So hopefully down the line in the future, that will be a possibility.
So I will ask the Chirag, GBM doesn't have symptoms till the grade 4. Is that right? So maybe there is a way that you can figure out the GBM, not from the brain, but maybe other biomarkers.
Possibility.
Yeah. I think that's a really important point. Like, you know, we sometimes consider glioblastoma and pancreatic cancer as being these late diagnoses just for the same fact that we don't really have any known modifiable risk factors for them to tell people to avoid. We don't do any kind of routine screening that, you know, we normally do for, let's say, breast cancer with mammography or colon cancer with colonoscopies. So unfortunately for these particular cancers, when they do get diagnosed, they're late stage, and then they become very hard to treat, and they ultimately lead to that poor prognosis. And so you're right. I mean, you know, in the ideal world, and I've discussed this with Mort before, if we really want to get early detection of brain tumors, we'd want to do an annual MRI scan, let's say, when the person turns, from youth, for example, because it's not ionizing, it's not ionizing radiation. It's just a magnet, but the costs are prohibitive for the healthcare system, and so it doesn't make sense to screen for brain tumors using an MRI. But I think, as you've mentioned here, if there are any other kind of biomarkers in other parts of the body or other organs that may give some early indicator that we never even thought of before, that could be a more feasible route to then screen earlier on for certain cancers that are otherwise currently hard to screen for. So I think that's a really amazing insight. Yeah. There's another question here, Joyonna, from the community. They're saying that in the 90s, a lot of colleges mandated all their majors across all departments to learn about computer science because that was going to be a really vital tool for the future. Yes. So are you aware of any kind of schools nowadays that are taking the lead in requiring all their majors to take data science related courses, or professional societies that are pushing for this before it's too late?
So when I was doing my postdoc at the University of Florida, I know that the graduate students there, they were pushing them to take data science courses and learn about computer science. I don't know of the specifics of which schools are mandated it. I would advise that individual to, if they're interested in attending that school, is to look that school up and see, look at the curriculum for the program and see if they have courses that are required as the core curriculum. But I know a lot of schools are at least taking the initiative where they're including electives and courses available to students that focus on data science. I'm just not sure which ones are like saying you have to do it.
So it's a good question. I like it because I claim sometimes that data science knowledge is like a driving license in the science. So there is a lot of data and you really know how to use it, utilize it. And you need to learn how to get ideas or results interpreted.
I totally agree with you. You have to really know how to infer from the data, make sense of it. You have to know how to measure it the correct way, examine, evaluate it, especially when you're trying to solve a particular scientific problem. So I totally agree with you.
I guess one of the other questions that we saw come through is kind of when you're working on these different solutions, like how well educated should you be as a data scientist on the regulation and policy aspects that are going to come in regards to healthcare later
on? So in terms of the regulation, I think you definitely need to know about HIPAA. You definitely need to know about any data security measures in terms of, who's going to access, who's going to control the data, de-identifying, any very private data that doesn't need to be out to the public. So I don't think it has to be too in-depth. I think if you are a director of an organization, you could always hire somebody because there are actually programs out there that train people to understand the regulation part and policy. I'm in like a similar program. I'm in a policy program, but you can actually bring those people into your organization. If you just have a basic understanding of it and the importance of it, you can have somebody else to really handle all of that. And you don't necessarily have to go get an education. Sometimes it's also just through experience, getting exposure to dealing with those policies, when those questions come up and handling them appropriately.
Also, putting your public policy hat on, we're seeing this kind of proliferation and acceleration of various, AI technologies, driverless cars, et cetera, outpacing the ability for governments and local jurisdictions to regulate them because even the politicians don't know what the heck is going on. So is there any concern or kind of internal forward-looking thinking at the NIH and things like that to help provide guidance to the political leaders so that they can provide some kind of framework or boundaries, or at least bumpers for AI technology so that it doesn't get out of control? Are there concerns or thoughts about that? How do we even think about putting regulations on something that's constantly evolving at such a rapid pace?
So I know that NIH are currently in talks about data science. That's a big thing, and especially when it comes to security and privacy. They have actually created a strategic plan for data science and artificial intelligence, where they really talk about the importance of data sharing and security. But the other thing that they're definitely also trying to do, they're also in the need of hiring a lot of data scientists. So there's a big push at NIH to hire and bring them into the organization to help them with aspects of that.
So the policies could be related to several things. I don't know what areas NIH is focusing on. There is definitely privacy issues is one concern.
Mhm.
And there is another one is reliability of data, and getting approvals is another problem. And then the third one, I'm also very interested in like IP things, which may not be related to NIH, maybe, because there is a lot of NIH supports a lot of, studies, and some studies also goes into that. So what do you think about what policies that NIH focuses on, or is it all the general things they're covered?
So I don't think they have implemented any policies necessary to cover all those topics. They're in the process of doing that. So that's why they created a strategic plan. They do have policies where a lot of the scientists that are doing research or have funded grants through NIH, where they have to, give NIH access to their data. And there you get into like a lot of the privacy, but usually it's in a secure place. And currently, usually only the scientists will have access to it, but they have allowed some data to be open access if there isn't any privacy issues. But I know they're currently in talks about what to do about all those matters when it comes to privacy liability.
So, Joyonna, based on your kind of diverse experience from multiple fields of, science, neurosciences, arts, and biology, technology, what is your vision for the future of AI in healthcare? Not only specifically to your company, but where are we headed in 5 or 10 years? I really liked how you said you're a planner. You kind of plan ahead for the future. Where do you think we'll be, in that time frame?
I think like I can just talk about examples of technology that I envision in the future. I envision that MRI will, whenever you're doing like a full body scan of somebody, you don't have to be in this like huge machine, that maybe we could have something that's held hand and you just put over somebody and it can tell, what's wrong with them. Or maybe it could just be something you just do like a little sticker, a wearable, and they can figure out. That would be really nice. I don't think that's going to be in the next 5 or 10 years. That might be a little bit longer down the line. So that's one example. Another thing is having a lot of AI technology within the home, such that we can have like our own personal assistants. I think sometimes we have so much going on in our lives. And then I think with technology, it's just having access to so much information that can help us with improving the way we go about the way that we live every day. So it'd be nice to have a personal assistant that is multi-dimensional when it comes to people's well-being. So this is somebody that can, a personal assistant that can help you with managing your finances. Maybe it can help you with improving your physical health, helping you with your social abilities when you're interacting with people and networking. Or even it can help you with, from an emotional perspective, your state of mind, or even intellectual, where you can just become more educated about a particular topic that you're interested in. Or it can help you also with your job, just telling you how to plan, if you want to look for a promotion down the line one day. So just having like a lot of devices within the home where that can help us and assist us with our everyday lives will be really awesome down the line.
Yeah, I like that personal assistant idea. You may have maybe robot doctors at home. They do everything for you. Maybe next 50 years.
Maybe.
This robot surgery is really popular now. There's some robot surgery companies, but they are more like assisting doctors in that. but it's getting more interesting, and I can't imagine what may happen in the next 50 years. But I am envisioning a lot of cool things will happen.
Yes.
Then the policies goes really important.
Yes.
So, Chirag, do you have anything to add, Ryan?
Well, I guess, kind of working towards that vision, I wonder, with the company that you have, are you envisioning like trying to create like a suite of devices to, as the personal assistant, that can be kind of an overarching thing. Like you talked about the MRI, there's multiple types of diagnostics. I mean, we have things that we look at like, doing like image capture type stuff where we can use computer vision to detect different motion and see if there's a problem. We have like a smart toilet for biomarkers. What do you envision kind of for your company and being able to kind of assess a lot of these things, at least in the near future?
So I think one of the things we were considering is the wearable device that I was talking about earlier. We wanted to expand it so it doesn't just focus on monitoring in real time a particular condition, but maybe could do multiple conditions at one time. That'll be really interesting, but I do think we have to really focus on just getting that one part first, because just trying to understand, different health diseases and disorders that might be affecting different parts of the body can get a little bit complicated. And then just really making sense of those massive data sets can be cumbersome. So that's something that we're definitely envisioning. Hopefully we'll be at the forefront and collaborating with a lot of people across the world. Because I think the thing is not just focusing on just people within the US, but being able to collaborate with other individuals and groups all across the world, because a lot of the stuff that we want to create can really help people, and it doesn't matter where you're from. So just being more collaborative and doing some really interesting, cool things in the future. Hopefully we'll be at the forefront of that.
I guess the real question is, with your emphasis of your company on the Internet of Things, getting to your point about, being more of a global outreach and, bringing in multiple countries from various stages, whether they're developed countries or developing countries. Do you see that this is going to be a facilitator to help drive down the costs of the production of wearables so that they are affordable and feasible to use all around the world to provide high quality data, so we can kind of gather this and get a better understanding of, like you were saying, different subpopulations or subgroups?
Yes. I think it definitely, especially if you can do buy-in with a lot of health insurance companies or even organizations that support those populations that even might be at different income levels. So I think it definitely will help. And then it also can help people that are at very long distances from, a healthcare facility where they need to get help. So I think a lot of the wearable devices can really come in handy and help and drive down some of the healthcare costs when people have to go in, especially if they have to go into an emergency room versus just going in to see like a regular primary care, physician or a general practitioner.
That's great. Actually, we come close to the end of the time. So I like that insightful conversation. Thank you, Joyonna. Ryan,
no problem. I really enjoyed.
Yeah, I appreciate your time and your conversation on those issues. So we have a YouTube channel. I recommend everyone to just subscribe in the channel. We have the records of this previous and future events. So I hope you enjoyed. Thanks for everyone for time and effort. Thanks.
Bye.
Thank you.
Bye.
Bye.
Thank you.
Thank you.